It is one of the very common concern that after doing sonography, many of the times the patient is advised CT scan of the abdomen. Now, why is that? Once the sonography is done, what is the need of CT scan? So we need to understand a very important thing, that in the sonography, we can see the structures from only one side. So if you are doing the sonography, most of the radiologists, they do it from front side, so they can see the organs from front side, from laterally we can see. But in the CT scan, we can see the same structure 360-degree view, means you get an axial cuts. Axial cuts means you will get an image of the abdomen like this, where all the organs will be placed. Like here, the kidney will be here, the liver will be on the right side. Everything you can see from front, from lateral, from medial part, and from the posterior part. So CT scan is a very much superior test compared to sonography, where it comes to very well delineation, very well demarcation, seeing from all the angles, and there are so many things which we may not be able to see in sonography. In the sonography, one of the most common problem is whenever someone eats, whenever someone takes food, that time the food releases so much of gases. So these gases simply won't let the sonography rays penetrate inside deeper. So many of the times we may not be able to see so many structures because of the gases. More are the gases in the gut, in the abdomen, the sonography rays cannot penetrate inside. So you may not be able to see structures like spleen, pancreas, appendix, many of the times bladder or intestine very well. So that is the reason, if you want to see a very clearer, very detailed structure from anterior, from lateral side, from medial side, from the posterior side, if you want to see a very minute things, we can go for CT scan. Whereas ultrasonography is also very good test, but it has inherent problems, like many of the times we may not be able to see the structure very properly because of the poor penetration of this ultrasonography rays. That can be because of the gases, that can be because of the obesity. Obesity is one of the important factor, because the ultrasonography rays may not penetrate to a deeper level because of the obesity, because of the fat. This problem is usually not at all seen with the CT scan, because CT scan can simply see structure at any depth, because it is not limited by the obesity or by the fat. So fat you will be able to see completely differently, and the inside structures you'll be able to see very clearly, very well delineated. So it is not restricted by the obesity. So for an obese person, definitely CT scan is much more superior compared to sonography. Thank you.